So when there is fluids where it's not supposed to be in the lungs, then only they have like symptoms like coughing or like
shortness of breath,
difficulty to breathe, not able to perform their activity.
Right.
So those are symptoms of a failing heart.
Okay.
And there are many causes to it as well.
Let's do a self-assessment now, doctor, because I know I've come across some articles, and even in school they've all taught us on how to measure our BPMs, our beats per minute, and and we have this sort of a timetable, a bracket that says if your heartbeat falls anywhere between this and this, and then you are okay. If it falls below that, or I think a higher heart rate it leads to somebody who is actually pretty unhealthy. And if your lower heart rate, if like athletes, I think their heart beats at about
very low.
Very low. So
right.
It's like,
you are right.
And for somebody who really has an ailing heart, the heart is working harder than usual. Yeah. So how do we do a self-assessment now, so to speak?
Okay, so you have this measurement.
Okay.
We can divide it into subjective and objective measurement. Okay. So subjective is something that you feel for yourself or the individual on their performance. Objective is more accurate measurement. So you have your heart rate, your blood pressure, you have your metabolic tolerance, VO2 max, and target heart rate, and so on. That's for objective measurement. You can assess by both. One you can do at home, one you can have a center to do it.
Okay.
The way is we must look at the response of the heart during our activity. Because
so you're not supposed to be doing it when you're rested, but you have to do it after you've done a set of activities.
When we are sleeping, the heart rate can go as low as 40 to 50 beats per minute, and that is acceptable.
Okay.
Because we are sleeping. The heart is also resting. That's right. And of course, depending on the intensity of our physical activity, then we should correlate the response to how fast our rate is, right? So, best way, if you want to subjectively classify, if you have to ask yourself on how is the person's baseline, meaning that what were they able to do before this?
Okay.
So some would say that last time I could climb up stairs 4, 5.
Walking up a flight of stairs was a walk in the park for me, but now I'm gasping for air.
Correct. So that's a subjective assessment. If it's an objective assessment, we can ask them to go on a stress test. By putting on a treadmill or on a bicycle. And then at the same time, we will measure their heart rate, blood pressure, VO2 max. To get the correct response.
Right. Yeah. So I think to be fair for our listeners, if you really want to get an in-depth, assessment of your heart condition, then it's best to visit a doctor and get. But it's purely based on, like you mentioned, the subjective assessments that you do. Like if you notice yourself not being able to carry out the regular day-to-day activities that you once upon a time could do effortlessly, like a walk in the park, but now if you're struggling to do it, then probably it's time to
I had patients who are athletes before, meaning that they were able to run 10 kilometers, no issue. But then they could feel themselves that their performance is
diminishing.
Yes. So up to 5 kilometers, they feel like already short of breath, which is not normal to them. But when people say that, you can run 5 kilometers, alright, no issue.
It's good you touched on athletes, because my next question is going to be on that. But we go for a quick break first, Doctor. Today on Health on Traxx, Anil on the mic is speaking to Dr. Kuzari Sani. He's a consultant internal medicine and clinical cardiologist at UITM Private Specialist Center. And Dr. Kuzari today is talking to us and teaching us on how we can have a healthy heart. Don't go anywhere. Health on Traxx. We'll be right back. Good morning and welcome back to Health on Traxx Momentum, a show where we speak to experts to educate all of our listeners, including educate ourselves on how we can enhance our lives so that we can have a better quality of life. And today we're talking about the heart with a regular here in our studios. His name is Dr. Kuzari Sani. He's a consultant internal medicine and clinical cardiologist at UITM Private Specialist Center on our topic today, which is how to have a healthy heart. Dr. Kuzari, welcome back to Health on Traxx.
Thanks, Anil.
So now you were talking about athletes who complained who said that once upon a time they were able to run 10 kilometers, but then there came a point in their lives where they felt like they're no longer able to do the things that they were doing. And we have people right now who are majority of people, I see a lot of people who are so concerned about their health. They're heading out for runs on weekend, the weekend warriors, the weekend athletes, cycling and running. And it's sad to hear sometimes, we hear stories of people who go out cycling and they collapse all of a sudden. We've heard of people playing the sport of badminton and collapsing on the court as well. Soccer, but primarily it's either while they're running on the track, cycling, or playing badminton. Is it because we're doing too much, Doctor?
Okay, Anil, that's a really good question, Anil. Yeah, so there are a few reasons for that to happen, meaning that those who develop sudden cardiac arrest during exercise, or sometimes they also had a heart attack during exercise. Okay, so thing is, the incidence of cardiac arrest is not as many as heart attack. Okay, heart attack may lead to cardiac arrest, but sudden cardiac arrest
these are two different things.
Two different things. Yes, that's right. Okay, so heart attack is the bulk, the major issue. Okay, in fact, is still the killer of our population, rakyat Malaysia, for the past more than 10 years.
Yeah.
The killer number one in the country is heart attack or chronic arterial disease. But the sudden cardiac arrest is quite rare. Okay, so there are many reasons to it, and sometimes it's because of inherited conditions, meaning from congenital. It could be from the structure of the heart itself, or due to the electrical activity of the heart. Okay,
electrical activity.
Yeah. So because every pump activity is led by the electrical impulse.
Okay, let me stop you there for a while. Just backtrack a little bit, Doctor. Now, in simple terms, right? I want you to describe what is a heart attack. Describe the scenario of a heart attack. What does the heart go through that we suffer a heart attack? What happens?
Okay, so the heart is continuously pumping, right?
Okay.
So it has its own supply of oxygen and nutrition for it to continuously working.
Okay.
All right, meaning that there is a
steady supply of whatever pipe supplying
for
whatever
the heart
it needs
to
for it to pump.
Right. So what happens in heart attack is actually this nutrition, the oxygen, is suddenly cut off.
So completely cut off.
Completely cut off.
It's not getting anything that it needs to pump.
Yes. So there are a few types of heart attack. You can have your mild and major. Major is totally cut off.
Okay.
And your heart suddenly cannot pump and cannot function.
And this is due to maybe blockages.
That is right. That is right. Okay. So when you ask about why it happens in the sports activity individual, one is overstressing of the heart. Okay. Number two other factors is that sometimes what we see is we have to control other risk factors, meaning that any predisposition to someone have a heart attack needs to be managed. So meaning that I had patients that, doctor, I am young, I am 30 years old, I play futsal, I can run, I have no medical problem, my pressure is okay, cholesterol, sugar is okay, but why do I get a heart attack? Because their lifestyle. Okay? So when they smoke, they do cigarette smoking, or they are very stressed, inadequate rest. So these are also predispose them to have heart attack. So not only that one or two risks that we need to control, we need to look as a whole.
Holistic.
Yes.
So for someone who is physically active on weekends, who plays badminton or runs, what should they be concerned about, Doctor? What's your message to them? They're listening now, so they can avoid themselves. So it has to be stage to stage. Okay, meaning that stage 1, stage 2, stage 3. Okay, so don't go to overdo themselves. Sometimes when they are not prepared for a run, like example, they go on a marathon. Okay, sometimes we hear like half marathon, full marathon, and
few of people collapse, meaning they are not prepared for it.
The body or the heart is not accustomed to go through that kind of a stress. So would you suggest that they stop when they reach a point of exhaustion?
Yep. And they have to prepare to go for a big event or big run.
Train, don't just turn up all of a sudden.
Yes. So a lot of times they think that, okay, I am usual to 1, 3, 5 kilometers. Now I want to go for 10, 20, right? I think I can do. So that's actually safer to get yourself trained for going for events.
Prepare before heading out for that big leap. Now let's talk about the food. I've heard of food for brains.
Yes.
You know, eat a lot of almonds and drink a lot of things, vegetables, and these things are all good food for the brain.
Yes.
What are good foods for the heart, doctor?
Actually, we hear it quite a lot, right? But whether can it be practical or not? Because when I talk to people or talk to patients, right, it's not easy to ask someone to change their diet next day. You know, you're like already used to nasi lemak, roti, chapati. And suddenly, hey, tomorrow you ask me to change my whole diet, my entire life. How is that? So how I wanna make it practical is the amount and also the timing of the food intake. Yeah. So amount is not only food, it's also the drinks that we consume.
Okay.
Which include because when we eat there will be like teh tarik, coffee.
Yeah. Of course.
Yeah, chocolate drink.
Very unhealthy choices.
So not only the food but also the drinks and the amount. So we don't actually need to have intake a lot of calories if we don't burn them. And of course, like you mentioned, the type of food. Of course, preferably is greens and fruits.
Greens and fruits.
Yeah, is better than meat and carbohydrates.
What about any additional supplementation, any form of vitamins? What sort of vitamin category?
It's actually if we eat healthy foods, we don't really need
so when you say healthy, doctor, anything that is not oily, anything that's not fried, just like what typically we all advised. Anything that is not deep fried, too much of oil, less carbohydrate, less sugar, and things like that.
Yes. In general, it's like it is better to eat at home rather than to.
Better to eat at home.
Because you can, quantify your own cooking, so you know how much of salt, how much of sugar, and.
I read a statistic last week and I shared it on radio. It said 75% of people actually go to a search engine. I'm not supposed to mention the name of the search engine, but it's a very popular search engine. G starts with the letter G, right? So when they experience symptoms in their bodies, what they do is they go onto this G search engine and they search for all of these. They type these symptoms out, and then they pre-diagnose themselves, and then only after that they go to the doctor. And then the doctor actually finds something that's completely opposite to what they thought they have. And before the doctor can actually start addressing the condition that they're having, he spends a long time trying to tell them what they research is completely wrong. Have you experienced that?
Yes. So you're right. So if the condition is not acute, meaning that it's a stable condition, then it's fine. But what problem arises when it is acute condition? For example, like is a heart attack. Okay, the longer the heart attack is, the longer the blockage of the vessel is causing more damage to the heart. So the delay in seeking treatment is actually the more damage to the heart. So if it's something which is not urgent, then we can have a discussion, consultation, and then re-educate ourselves. But if it's something urgent, then it's more, can be also life-threatening.
Life-threatening as well. Okay. Let's jump in for a quick break, doctor. Today on Health on Traxx, I'm speaking to Dr. Huzairi Sani, a consultant internal medicine and clinical cardiologist at the UITM Private Specialist Center. And Dr. Huzairi today is talking to us about how to have a healthy heart. Keep it right here on Health on Traxx. Good morning and welcome back to Health on Traxx, a special show that comes on every Mondays in the second hour of Traxx Momentum, where we talk about matters that concern our health. And today we're talking about our heart. The heart. The heart doesn't stop working, isn't it, Doctor? Dr. Khuzairi is in the studio. Dr. Khuzairi Sani, a consultant internal medicine and clinical cardiologist at UITM Private Specialist Center. The perfect man for us to have in the studio and talk to us about our heart.
Thanks, Daniel.
You're welcome, Doctor. It's always a pleasure having you with us and to have this chat with you. So now, on to some serious questions. When I say serious, I say it's serious because most of us take what the doctor tells us seriously.
Okay.
But also another majority, which includes people like me as well, the moment we walk out of the clinic, the doctor will always tell you, don't eat anything fried, don't eat anything oily, have a little bit rice. You walk out of the clinic, you see a restaurant right across the street, you're like, doctor, because the doctor told me I have to eat. I cannot take my medicines on an empty stomach. Well, I might as well go and eat something. So, doctor, okay. Let's start off before we go into food, right? Exercise. What is the optimum? What are the kinds of exercise? Give us a simple regime we can follow every day so that we can sort of keep our hearts healthy.
Okay. Yeah, I mean, you're right. So, I think for the diet, it has to be another session. Because it will be a very long session itself.
Right,
okay.
right.
But I want to make it practical. Yeah, I want to try to make it as practical as possible. So when it comes to the exercise, it depends on what type of exercise we do and how much we do. Okay. So it can be classified into low intensity, moderate intensity, or high intensity. Okay, so a lot of like those indoor sports, bowling, or maybe like archery, or like chess. Those are low intensity.
Okay.
Like soccer, marathons, are all those high intensity sports. Okay. So how much is depend on what type of sports do they do. Okay.
But what about for those who are not sporting, people who don't really play any sport recreationally?
Yes. So if I would say physical exercise, any would do. Walk at the park is also good. But it has to be regular.
Okay.
And of course the duration.
Okay.
So we have guidelines that we recommend. So moderate intensity is 150 minutes per week.
Okay.
That is also subjective. I mean, depends on how the person wanna divide per week. You can do like 3 times a week, or you can do 5 times a week.
Okay.
But what I would like to emphasize, or I would like to promote is you can also do exercise at home. You see, you don't have to like look at the weather, or it's already night time. Because you can also do home workout. Yeah, and it's also can be as intense as well, depending on the workout. So everyone is busy now. Okay, everyone is have their own things to do, and kids work, studying.
Even kids have become very busy nowadays. Yeah, they got classes.
Schooling. Yeah. Exactly. So I always now encourage that. Then they will come say, oh doctor, saya sibuk lah, saya tak ada masa lah. Okay. And hujan, cuaca is not good. But I would say do at home. Do it at home.
Do it at home.
You can do like, after work 5 to 6 p.m. or you can even do like 9 p.m., 10 p.m. Or you can let the kids to go to bed first and then you do. It's also possible.
Okay. I have seen some cases where I think you mentioned really well that you should do some moderate exercise for those who are not physically active. If you're not someone who plays games regularly, start off with moderate exercise, but don't go on the intense scale yet, because we've heard of people who suffer cardiac arrest after doing high intensity interval trainings, HIIT trainings. Intense bursts of physical activity that can help you break a sweat. And then that sort of overworks your heart, and then you've heard of people collapsing and also having a heart attack. Doctor, thank you very much for setting aside your time. It's always a pleasure talking to you. We learn a lot of things. But before we let you go, you've been on the ground, you meet patients every day, and I'm sure there's some things that you want to address. So any parting words?
Okay, so I've prepared a mnemonic for a healthy heart. Okay, so we take our heart seriously, our health seriously, right? So it's term pride, PRIDE. Okay. P stands for physical activity.
Okay.
R is rest. Okay?
Okay.
Also, after we exercise, we also need to rest. We also need to have adequate sleep and also stress-free.
Okay.
I is for intake.
Okay.
Which is our food and our drinks. Okay, as we discussed. D is for drugs, which is no to drug smoking or vaping, and E is for excessive weight. Okay, so we must always aim to have normal BMI and normal weight. So, and as a whole, so not only we focus on one component, but we also look at these others to have a healthy body.
Okay, all right, pride. Thank you, Doctor.
Thank
you
you,
have a good
Anil.
day. It's a great conversation, and we maybe, as you mentioned, we need to have you back in the studio again to talk about food for the heart. Yeah,
Thanks.
Because you said that requires another session altogether, and that's something that I'm very interested in. But anyway, you have a lovely day today, Doctor. Thank you.
You too, Anil. Take care.
Right. Today on Health on Traxx, we just wrapped up a conversation with Dr. Huzairi Sani, a consultant internal medicine and clinical cardiologist at the UITM Private Specialist Center, and today he spoke to us about how to have a healthy